Right, as you know, it's very busy here on the Noon Show. We have all these experts here from Intermountain Healthcare, and they're taking your calls today. We're talking about sleep. It's so important, and we have an expert here. This is Dr. Dixie Harris. She is with the Utah Valley Sleep Center and the American Fork Sleep Center. And today we're talking about signs and symptoms of sleep disorders.
Yes, and most importantly, the signs and symptoms to consider are things for sleep apnea. And sleep apnea is where you stop breathing when you're sleeping, you relax. Most of the times it's because of your upper airway, your neck level, relaxing down. So,
and there's different things you can do with that, right?
Yes. So if you have sleep apnea, it's important to get it evaluated and treated, because if you don't have it treated, it can lead to problems such as heart disease, strokes, cardiac arrhythmias, including also very important is attention issues such as driving.
Now, if you are a heavy snorer, is that a sign of sleep apnea?
It can be, or it can just be snoring alone. Also, you worry about, like, if your bed partner or spouse tells you you're stopping breathing during the night, that's also a significant sign.
Yeah.
Other problems could be if you have heart problems, heart arrhythmias. Many times the cardiologists send patients to the sleep lab to get evaluated for sleep apnea.
Okay, now these experts here today, you can ask those same kinds of questions, right?
Oh, definitely.
Yeah. So what's the number one question you might be getting today? What do people want to know?
They probably want to know, how do you diagnose sleep apnea? How do I find out if I have sleep apnea?
Okay, and you have sleep centers all around that actually can do that. So the main thing is, get into a sleep center, because you can probably pretty well closely calculate what a problem is, can't you?
Yes, I would definitely recommend speaking to your primary care, and they can ask you a few pointed questions that can really guide if you need a sleep study. If you don't, I think that would be very important.
Okay, and you also brought this chart along right here, and with adults, and that's who we'll talk about right now, you need at least that 7 to 9 hours of sleep, right?
Yes. Did you get that last night?
I did not, because I have to get up about 2:30, 2:45 in the morning to get to work. And that's the thing, a lot of us have these schedules where maybe we don't get the sleep we need.
Yes, and that is a very important thing to realize, especially when you're driving home after working all day and haven't gotten much sleep. We also are very concerned about our bus drivers, the UTA.
Oh, absolutely. So it's a safety issue and health issue. Well, thank you very much, Doctor, for being with us. Remember, the number right here, 908-0680. Give us a call. We're going to be here throughout the rest of the day, and take advantage of this opportunity to get some help and assistance on sleep.